many guidelines have started moving towards plant-based diet. Belgium says for calcium sake you don't need to take dairy. They say drinking water has enough of calcium. That is what they say. Nordic Council says it's useful for all chronic disorders. Okay, and China says it improves our immunity.
Our next distinguished speaker is Dr. G. Rajendran, who is an MD and DM in cardiology. I welcome Dr. Rajendran to give his talk on plant-based diet and coronary artery disease.
Good evening, everyone. Well, plant-based diet, the future of CVD, that's what I'm going to talk on. What is actually diet? Is it a verb or a noun? How many of you say it's a noun? Okay, how many of you say it's a verb? How many of you say it's both? Has to be both. Well, in Greek language, it's a noun. It says it's a way of living, which includes everything. Okay. And in Latin, it's verb. Okay, we always say it's Greek and Latin, isn't it? So both of them are there in the slide. And the most important thing which I thought I should actually put it up is this. It's basically a sentence, and at times happens to be a death sentence for many of us. This was published in Lancet Global Health. Leading risk factors. What constitutes 56% of? Look at that. It's as simple as that. Okay, this is and I think in the morning we had a discussion about air pollution to start with. Look at that. Air pollution is placed way ahead of tobacco. Okay, this is again the global burden of disease study. And what is important is this: what we don't take. What we don't take in the sense, there were fruits, vegetables, nuts and seeds, whole grains, omega-3 fatty acids and fiber. Okay, put those things which we don't take, and that constitutes the plant-based diet, which is going to influence the globe. These are the 5 P's which we are going to see. Now, morning I mentioned about cricket match. Okay, India-Pakistan, when they play together, the ground is full. I'm very sure it will be much more fuller, if it's an acceptable term, if India and China play. Is that not the case? But look at this, the difference between India and China. And why do you think China had, at least this is in 2012 if I remember, 13. Why do you think China has a lesser cardiovascular mortality than India? It's a point to think over, isn't it? I'm opening it up. Look at the answer there. Because they consume more vegetables than us. It's as simple as that. So instead of saying I told a bunch of things and the patient is not following anything, tell just one thing which the patient has to take more. That's a point which I would like to emphasize upon again and again. Okay, look at these numbers. 56% of the world's vegetable consumption is by China, including, it's a holds good for fruits also. Okay, which is the place which has the lowest prevalence of heart disease? I'll give you a clue. That's something related to this? No, I'm talking, which is the country which has, I've written the answer is on your screen. Amazon, fine. So, there is a small place in Amazon called Simane. Okay, that has the lowest incidence of heart disease, prevalence of heart disease. And people started doing a study in those people as to why they have this. Okay, so basic way to decide on subclinical atherosclerosis is to look for a CT coronary calcium. Okay, it's a non-contrast study where you just check out the calcium deposition alone. Okay, you take people less than 45 or less than that. None of the Simanis had coronary calcium, whereas 1/4 of the Americans had already calcium. This is despite the fact we all were talking about inflammation, isn't it? Sir was talking, Dr. Ajay was talking. This is despite the fact they had high CRP, high degree of inflammation. Okay, let's see what they were doing. Women were working like this. They had to go climb and fetch berries. Okay, and hunting was one of their most important job. Men averaged around 17,000 steps a day. They were not going for walking or jogging with the shoes on. Okay, so women could achieve 16,000. That's something which is important to know. Even the people above 60 achieved a step count of around 15,000 a day. It's not per week. Okay, look at this. What are they doing? Fishing. And look at the fish they have got. So this itself is a big job. Okay, and look at this. These are the animals they were feeding on, and they were eating also tapir. Tapir is something a mix of pig and hippocampus. They were also eating a lot of fruits. I don't think they were eating only non-veg. Okay, only 25% of what they were eating came from that non-veg, and rest of it was all from vegetarian. So they were consuming 75% of their food from natural food. That's the most important thing. Okay, so look at this. We blame carbohydrate. Now everybody talks about low carbohydrate diet. Look at the amount of carbohydrate they were consuming. Most of it was complex carbohydrate. It was not simple carbohydrate. Okay, how many of you have heard about the special period of Cuba? In special period of Cuba is from 1990 to 1995. So that was the period when USSR basically disintegrated, and Americans had imposed a ban on the Cuba. So they were getting nothing from outside. Most of the eatables, fertilizers, pesticides, everything was coming from outside. Everything stopped at one point of time. Okay, so people resorted to cycling. Okay, Fidel Castro is the man who pumped in lot of energy into their people. They said, okay, fine, let's not depend on anybody. Let's depend on our own strengths. Okay, people overnight, all these bunks became empty, so they could not transport also anything. Okay, so they had no choice than to turn into vegan, because they had to, and that too organic vegans, because they had no other supply. Okay, so overnight they became vegans. So 1990 to 1995 witnessed very low mortality of heart disease in Cuba. Like in the morning, as I said, from 95 onwards they started getting everything, and again all the diseases were back. Okay, so this is about places. So what was the second thing I was talking about? Lester Morrison was the first person to work on diet in 1940s itself. That time nothing was available as a treatment for heart disease. Look at that. He didn't name it as whole food plant-based diet, but they omitted all the fat-rich diet. And they followed up these people for around 12 years, and 38% of the people survived without any treatment, whereas none in the control group survived. So that was the first thing, and the ones which put up lower down are their books. The second important person is Nathan Pritikin. How many of you have read Pritikin? I'm sure some of you must have, definitely. Nathan Pritikin, he is not a doctor. Okay, he's basically an aerospace engineer with a lot of patents to his name, and he had serious heart blocks detected in 40s. His total cholesterol was more than 300, and at that time again there were no statins, and people said, okay, fine, this is the end of the road, you should not work, you should not exert. This was the only advice it was given to him, and he said, no, there is no way I will follow all these things. And he started doing research on this Lester Morrison's work, and then he eventually went on to design a plant-based diet for himself, and people were saying that you are going to be deprived of a lot of micronutrients. So he didn't know how to check it. So just like I'm sure in Mumbai also there will be a lot of packages available for people. When they walk in, you prescribe 4 tests, they will come out with 400 tests for which you and me will not be actually knowing the results and normal values. Okay, so that sort of a package, he started doing it every month on him at his own cost, and he showed the people that he was not deficient in anything. Okay, and his total cholesterol dropped without statins. And look at the work. He and his team, he is no more now, but his Pritikin's work, Pritikin's clinic is going on. Okay, so these are the number of books which they have covered. And about de-Dawnish, I don't want to touch upon too much, but what is important is even the Medicare has approved his program. That one liner is good enough. There's more than a scientific evidence to say that de-Dawnish is acceptable. Esselstyn, again. And again, he is the person who has shown that there is reversal of atherosclerosis. Okay, 4-year follow-up. He showed that people who are adherent to the diet which was prescribed by him, 99.4% did not have any major cardiovascular events. And he claims an adherence rate of around 89%, which is unbelievable. Okay, because it was a protracted stuff from them. They kept on reminding, they kept on sending books, booklets, videos, and all those things throughout the period. So this is how they achieved this. And his wife and his son have come out with so many of these books. Women Warrior is the latest one which has come up. Okay, similarly, there are plenty of studies. None of them are actually whole food plant-based diet, but they're all predominantly plant-based diets. Okay, except possibly for the China study. The nurses' health study, again, is something which is important. As I thought this morning, I was discussing with the ophthalmology team that actually they can see whether what is claimed as whole food plant-based diet, people who follow that diet, they have less cataract. So the PDI, that's a plant-based diet index. HPD is healthy plant-based diet index and unhealthy plant-based index. This is the indices which they have used to study this population. And look at that reduction in the CVD mortality when the unhealthy plant-based diet, that is also important. You can't say that you are taking plant-based. Unhealthy plant-based diet increase the mortality in a group of individuals. Okay, that's about the second one. The third one, what are the processes involved? How all this plant-based diet can help? Well, it's needless to say that it has an effect on total cholesterol and LDL. And look at that. Look at this data. Okay, PCSK9 drops. One diet drops the cholesterol LDL level 1/3 of what PCSK9 does without money and side effects. Okay. And other than cholesterol, you see that LPA, lipoprotein A, is the most claimed one in Indians. Okay, many of us do it, but we don't see the reports because we don't have an answer for that. This is what we presume. But then look at this. LPA is also reduced by whole food plant-based diet, and small density LDL, that is something which we have started calculating in our own people, which is much higher in our Indian population than the LDL as such. Okay, that also comes down in this group of individuals. And a lot of other things, all these parameters do come down. So it works in various ways. It works on the dyslipidemia, gets down the blood pressure. I think in various talks we have covered on this, diabetes, obesity, and then improves the endothelial function. Okay, the nitric oxide production is improved only by the whole food plant-based diet, and no animal product supplements that. Okay, it covers the risk factors, it covers the basic pathogenesis, it covers the lifestyle factors. So these are the three ways your whole food plant-based diet improves. And this is a real tree which shows you in whatever ways plant-based diet can help. Okay, this is the common advertisements we see, buy one get one, or buy 3 get 1 free. But then there is buy one and get 3 free. It's more than get 3. That is with the plant-based diet. That's what we saw earlier. Okay, and this is something which I copied from a recent journal. There are so many things here which are all covered, taken care of by whole food plant-based diet. Okay, now all of them are actually moving towards whole food plant-based diet if you actually have a good look at what was the guidelines sometime earlier. Okay, recently I was talking to diabetologist, a famous person, asked him, is there a term called reversal of diabetes? Okay, he looked at me and said, no, maybe I haven't heard, because the focus is not on that. Okay, I think that this word was introduced a decade ago and has been redefined recently by the ADA itself. Okay, ADA also recommends whole food plant-based diet, and there are 3 associations which are definitely focusing on whole food plant-based diet. Okay, the last one is not exclusively on that, but then it promotes that. Okay, now let's see what are the countries which are actually promoting this. Okay, the second one must be a surprise for people. Qatar. Okay, let's see about the United Kingdom, Australia, Belgium, all these things. what they say, whole food plant-based diet is a complete diet. Qatar, what does he say? He again says it's a complete diet. And he also warns about the unhealthy plant-based diet. Norway says it's suitable for all groups, all walks, okay? Nordic Council says it's useful for all chronic disorders, okay? And China says, someone was talking about the inflammation, isn't it? It improves our immunity, that's what they say. Finland says it makes you move more, okay? It makes you smoke less. So your dietary habits have an influence on all the other 5 pillars of lifestyle. Okay, your sleep gets better. Okay, you tend to smoke less, you tend to walk more. Canadian guidelines, they have focused on plant-based milk. Okay, and one more thing, they said milk is not a definitive necessary substance. You know, when somebody asks you where got definitive evidence, I think for the cardiovascular disease we don't have a definitive evidence, though the ISLM, all the people actually want us to go milk free. Okay, you got an ethical reason, then it's fine. Okay, and they have actually moved it. Earlier in Canadian guidelines, milk was a separate food group. Now they have clubbed it with the proteins. That's the biggest leap forward. Okay, and they are also supporting take proteins plant-based as much as possible. Okay, and the other important thing is Belgium says for calcium's sake you don't need to take dairy. They say drinking water has enough of calcium. That is what they say. Many guidelines have started moving towards plant-based diet. Okay, so and look at this, supporters and informers. There are a lot of supporters for plant-based diet, a lot of informers for plant-based diet. This is all moving up forwards, and this is from the marketing side. They say that the vegans across the world have definitely doubled. Thank you very much for this opportunity.